Well, certainly in rheumatology, the clinical research projects that we do allow us to have access to drugs for our patients that otherwise we may not see for years. And we certainly have a lot of patients who have tried and failed more standard therapies, and so it's always nice to have that option. Gives the patients an opportunity to be kind of on the cutting edge of treatment of their condition, and similarly, all of us here in rheumatology enjoy the opportunity to see how new things are going to work as well. So it's a win-win situation from that standpoint. We don't recruit patients, literally off the street, if you will, for stage 1 clinical studies. I mean, the studies that we participate in are really for disorders that we treat on a daily basis and among the patients who are already established within our practice. Well, many of the studies have certain requirements that patients have to have a certain diagnosis or a certain disease activity level. For instance, in rheumatoid arthritis, they might have to have more active disease. They may have to have already failed some particular medication regimen. So oftentimes the patient is made for an individual study. Other times patients have, as I mentioned, have already used all the more standard therapies, and so they need something new. And so the clinical research study really gives us that opportunity to get them on a new medication, maybe different from anything they had used previously. Certainly in our clinic, no one is compelled to be on a study. If a patient has no interest in doing so, that's perfectly fine. We continue treating them just the way we had been previously. But I do help to allay patients' fears that by the time we get studies here in rheumatology, they're for drugs that have been studied already in numerous patients. And so we don't do the very earliest studies in terms of medications that haven't been fully vetted in terms of their safety for people. We're really looking at patients really more for stage 3 studies where they're drugs that could come to market pretty quickly thereafter. In some settings, we're able to obtain medications for patients through studies that maybe they wouldn't be able to afford, which is always a nice option. And the companies with which we work, oftentimes if those medications are effective, the patients are able to continue them even once the study is completed. So that's, I'll have to say, in rheumatology, when many drugs that we use to treat patients are very, very expensive and can cost a lot of money out of pocket, it's nice to have that option, because sometimes we can get medications that may have actually even been on the market for several years to patients who wouldn't otherwise be able to receive them, which is kind of nice.